CBC Complete Blood Count, Nursing Student Learning Module. Welcome. In this video, we will review the Complete Blood Count, or CBC. The CBC helps nurses understand oxygen carrying ability, infection and immune response, and clotting or bleeding risk.
A CBC is not just one number. It is a pattern of information that helps us understand what is happening in the body. Red blood cells, hemoglobin, and hematocrit tell us about oxygen carrying ability. If these numbers are low, we may think about anemia, blood loss, or decreased oxygen delivery. White blood cells help us evaluate infection, inflammation, immune response, or risk for infection if the count is too low. Platelets show clotting ability and help us understand bleeding risk. RBC indices give us more detail about anemia patterns. They help identify whether anemia may be microcytic, macrocytic, or related to another cause. So, the CBC gives a broad picture of oxygen status, infection risk, clotting ability, and anemia patterns. RBC stands for red blood cells. A low RBC count may suggest anemia or blood loss, while a high RBC count may be seen with dehydration or polycythemia. Hemoglobin, or HGB, is the oxygen-carrying protein inside red blood cells. Low hemoglobin may suggest anemia or bleeding. High hemoglobin may occur with dehydration or chronic low oxygen levels. Hematocrit, or HCT, tells us what percent of the blood is made of red blood cells. Low hematocrit can occur with anemia, bleeding, or overhydration. High hematocrit can occur with dehydration or polycythemia. White blood cells help fight infection. Low WBCs may suggest immune suppression or bone marrow suppression. High WBCs may suggest infection, inflammation, or stress. Platelets are clotting cells. Low platelets increase bleeding risk, while high platelets may increase clot risk or suggest inflammation. The key point is, do not look at one number alone. Read the CBC as a pattern. Think of the CBC in three major categories: oxygen, infection, and clotting. First, oxygen. RBCs, hemoglobin, and hematocrit help answer the question, can the blood carry enough oxygen? When these values are low, think about anemia, bleeding, or dilution from too much fluid. Clinically, watch for fatigue, pallor, shortness of breath, and tachycardia. Second, infection. White blood cells help answer the question, is infection, inflammation, or immune suppression present? A high WBC count often suggests infection or inflammation. A low WBC count means the client may have increased infection risk. Third, clotting. Platelets help answer the question, is there bleeding risk or clotting risk? Low platelets mean bleeding precautions are needed. Watch for petechiae, bruising, bleeding gums, or other signs of abnormal bleeding. This image explains the WBC differential, which tells us what types of white blood cells are increased or decreased. The total WBC count tells us that something may be happening, but the differential helps explain what kind of immune response is present. Neutrophils are the main cells for bacterial infection and acute inflammation. When neutrophils are high, think bacterial infection. When neutrophils are low, the client has a higher risk for infection. Lymphocytes are important for viral defense and immune memory. They are often associated with viral infections and immune responses. Monocytes are like cleanup cells. They may increase with chronic infection or chronic inflammation. Eosinophils are connected with allergies, asthma, parasites, and drug reactions. Basophils are less common, but they are involved with histamine and inflammatory responses, especially in allergic or inflammatory disorders. The main idea is, the WBC differential helps identify the type of immune problem, not just whether the WBC count is high or low. This image focuses on common anemia patterns. The key number here is MCV, which means mean corpuscular volume. MCV tells us the average size of the red blood cells. First, microcytic anemia means the red blood cells are smaller than normal. In CBC results, this usually shows as a low MCV. Common causes include iron deficiency, chronic disease, or thalassemia. Second, macrocytic anemia means the red blood cells are larger than normal. This usually shows as a high MCV. A common nursing clue is vitamin B12 deficiency or folate deficiency. Third, normocytic anemia means the red blood cells are normal size, but there are not enough of them. This can happen with acute blood loss, kidney disease, or chronic inflammation. So, when looking at anemia on a CBC, do not only ask, is hemoglobin low? Also ask, what is the MCV? The MCV helps point toward the likely anemia pattern. This image gives a simple order for reading a CBC. The goal is to use the same pattern every time, so the lab results feel less confusing. First, check the WBC count. Ask, is there a possible infection, inflammation, or immune suppression? A high WBC may point toward infection or stress. A low WBC may mean the patient has increased infection risk. Second, check hemoglobin and hematocrit. These help answer, can the blood carry enough oxygen? Low values may suggest anemia or bleeding. Third, check platelet. Ask, is there a bleeding risk or clotting risk? Low platelets increase bleeding risk, while high platelets may suggest inflammation or clot risk. Fourth, check the RBC indices, especially MCV. This helps identify the anemia pattern. Finally, compare the CBC to the patient's symptoms and trends. One lab value alone is not enough. Always connect the CBC to the patient's condition. This image is an important reminder. Do not interpret the CBC in isolation. Hydration status can change how the CBC looks. When a patient is dehydrated, plasma volume goes down. The blood becomes more concentrated, so hemoglobin and hematocrit may appear high. This does not always mean the body is making too many red blood cells. Sometimes it means there is less fluid in the bloodstream. Overhydration has the opposite effect. Too much fluid can dilute the blood, so hemoglobin and hematocrit may appear low. This may look like anemia, even when dilution is part of the explanation. That is why nurses should compare CBC values with the full patient picture. Vital signs, intake and output, edema, mucous membranes, and symptoms. CBC results are also more meaningful when compared with previous trends. One value gives information, but the pattern over time gives better clinical meaning. This image focuses on CBC red flags. These are not just numbers to memorize. They are warning signs that require patient assessment. A very low hemoglobin is concerning because the blood may not be carrying enough oxygen. Watch for chest pain, shortness of breath, tachycardia, syncope, severe fatigue, or signs of active bleeding. A very low WBC count, especially low neutrophils, means the patient has a high infection risk. In this situation, fever can become an emergency because the body may not be able to fight infection normally. Very low platelets create bleeding risk. Monitor for petechiae, bruising, bleeding gums, nosebleeds, or blood in the urine or stool. A very high WBC count may suggest severe infection, inflammation, sepsis, or possibly a hematologic disorder, depending on the patient's condition. The final nursing point is this: always connect the CBC result to the patient's symptoms, vital signs, history, and trends.